Hello and welcome to the fourth online meeting of the NHS formal public consultation called Modernising Health and Care Services in the Teignmouth and Dawlish area. The first thing I'd like to do is introduce myself. My name is Kevin Dixon. I'm the independent chair of Healthwatch in Torbay. I'm also a carer. I'm also a member of my local patient participation group, and I've been involved in the sort of health and social care and voluntary sector for about 30 or 40 years in South Devon. My particular role during this meeting is really just to facilitate and move things forward and make sure that your questions are actually responded to and answered. And I'll follow up with those if there's any sort of follow-up questions. So that's really my sort of role in this. I've also got colleagues behind the scenes who are both employees and volunteers with Healthwatch, and their role is as independent employees is really to supporting the consultation and acting as a sort of partner in this and just making sure that questions are actually answered. One thing I did want to interject, if just to show that plans don't always come to fruition, my neighbours are actually having a new kitchen installed. So if you hear odd sounds, that's what it is. So apologies for that one. Now, what the first thing I'd like to do is introduce the fellow panelists who will be responding to your questions as we go through. And so I won't go through their particular job titles. I'm sure they'll explain themselves a bit later. So we do have Joe Turl, Adele Jones, Dr. Paul Johnson, and Dr. Carly Karakusevic. So that's the four panelists that you'll be actually directing questions at a little bit later. Let me just go through the agenda to say what we're doing this afternoon. I've introduced myself. We'll be showing a short video, which is really sort of looking at the current model of care and the Health and Wellbeing Centre in Teignmouth and those kind of proposals. There will then be a presentation by the clinical chair of the CCG, who is Dr. Paul Johnson. Now, Paul will be looking at the background of the proposal and the proposal itself. And then we'll come into the sort of real meat, which is your opportunity to ask questions. So there'll be a question and answer session. And one thing that came up in previous sessions was what we're really trying to do is avoid jargon. If we come out with any sort of jargon statements or anything that people don't understand, just ask us to sort of clarify things, because that's always one of the issues around this topic. Now, this is how to explain how to ask a question and post a comment. Everyone asking can ask questions or share their views by using the question and answer function in Microsoft Teams. You should see an icon that shows a question mark in a speech bubble with another speech bubble behind it. If you click that icon, it will bring up a panel where you can type a question. And what we would like you to do, if possible, is to give us a name. It may just be your first name. Give us your full name if you'd like to. That would be absolutely terrific. But we'd really like an idea of where you come from. So possibly the first line of your postcode. So if I was typing in, I'd say Kevin TQ12, just to give us an idea. Or you might want to put in your village, I don't know, or town. It might be Dawlish, Bishop Stainton, Shalden, something like that, to give us a sort of general idea. What we want to do is really get out as wide as we possibly can. So that'll give us a nice kind of breakdown. When you've typed in your question, tap or click the paper aeroplane symbol and send it to us. Behind the scenes, my independent Healthwatch colleagues will then be moderating the posts and will aim to publish as many as possible. You can then read the published comments and questions in the featured tab of the Q&A panel. And what we're really trying to do is publish as many questions as we possibly can. So the posts are really being checked, not to censor anybody, but really to make sure there's nothing offensive. And we really didn't want any individuals named, either patients or clinicians or whatever. So and then you can post whenever you like. So if there's a question you have now, please just start and please sort of post those. Let's see, the meeting today will run until around 4:30. If we finish a little bit earlier, that's fine. But I think what we found in other sessions is that there's so many questions, so much interest in this topic that we continue as long as we can. And the first thing we're going to do now is show a video, and this should explain how the current model of care works and really how a health and wellbeing centre would further support that. So if I can ask my colleagues to post that video.
My name is Matthew Fox. I'm a GP in Dawlish. I've been a GP for 20 years. I live in Teignmouth and I've been supporting the patients at Teignmouth and Dawlish for 20 years. I spend one day a week working for Torbay Hospital as part of their intermediate care team. Every weekday morning, Monday to Friday, we sit down as a group of professionals. So that's a GP, one of the GPs from the local practices. That's our community health team. It involves our occupational therapists, our physios, our community nurses, district nurses, our mental health team as well, and our voluntary sector. Our team isn't just statutory NHS services. Having the voluntary sector embedded in the same room at the same time gives us the potential to really support our whole community.
I'm the intermediate care and therapy lead here at Coastal, and we at the team here work towards ensuring that people in the community are kept safe and at home on a day-to-day basis. My role is very much to support the team in delivering that. So the value of having us all in one room at the same time is really helpful, because it's beneficial to bring up not only the people that we discuss as part of intermediate care or in the community, is about the fact that you can bring anyone to the room, and because you've got a wealth of information there and you've got experts in all those different fields, all of us together are able to then figure out the best plan for that patient and on that day.
I'm the Community Services Manager for the Coastal Locality, so that means I'm responsible for the health and the social care teams that work out in the community to support people in their own homes staying as independent as possible. Enabling cross-working between voluntary sector, health, social care and primary care is absolutely vital in us being able to progress our services to the next level.
I'm the Community Nurse Manager for the Coastal Locality. My job involves overseeing the work of the community nurses and also the intermediate care nurses and the nurses that work in long-term conditions. So the aim is to have an oversight over the coastal locality of patient need and matching the right nurse to the right patient.
I'm Liam, one of the Coastal Health and Wellbeing coordinators. Our main role is to deal with the incoming referrals via phone and telephone and liaise with all the patients, relatives and various departments to gather information for the team to assess what a patient's situation is like and what input they need from our team.
Traditionally, people have thought of medicine being you go and see your GP, if you're poorly you go to hospital, when you are better you go back home again. And the only place you could have your care was in a traditional hospital. The world has really moved on, and there's really good evidence that actually if you can support people in their own home, you can actually support more patients than you could just in a traditional hospital ward. So for us, integrated care is actually how do we bring all the parts of our system together to work more powerfully on behalf of our patients.
People in Teignmouth and Dawlish are being urged to have their say about the shape of future health and care services once a new £8 million health and wellbeing centre is built in the heart of Teignmouth. Torbay and South Devon NHS Foundation Trust is planning to build a state-of-the-art new health facility so that GP services, health and care and voluntary sector services can be brought together under one roof in the centre of town, providing seamless care for patients and carers.
To have a centre that is actually on the level in town, a designed building that we've all been involved with, will really enable us to join up the relationships and the understanding of each other's roles, and the pressures on the different areas will really help that working in terms of how we link together to support clients going forward.
The Health and Wellbeing Centre would obviously be a new purpose-built building, so the room size would be government specified, there would be excellent access and good access for disabled people, which will be a considerable change to what we have now. I have been involved in the planning of this building for the last 4 years. We have had many meetings to discuss how it should be built, and we think the building we've come up with will provide everything that is needed to enable many multidisciplinary teams to work in the same building. So we'll be able to talk to social workers, occupational therapists, physiotherapists, pharmacists, and I think that will hugely improve the communication for all the healthcare in Teignmouth to the benefit of both patients and staff.
I think the really exciting thing about combining all of our services in one place is that ability to communicate with one another. It's that sharing of one big room and that sharing of knowledge. by having your general practice and your voluntary sector and your care teams in the same place, you can't help but actually support those patients in at the best possible fashion. Almost think, well, why wouldn't you want them all to be working in the same place to give that sharing and support of each other?
You can find out more by visiting the Devon CCG website.
Right, thank you very much for that. Now, what we'd like to do is to actually go straight into a presentation by our clinical lead. So if I could introduce Dr. Paul Johnson, who's the clinical chair of the Clinical Commissioning Group. And Paul, can I pass over to you?
Thank you very much, Kevin. And can I echo Kevin's welcome to everyone who's joined us here for this meeting over the next hour or so. Your presence here, your contributions are hugely valuable. So do post your questions and your comments. Let's have a conversation about some of the opportunities we have here in Teignmouth and Dawlish, and also some of the concerns that you may have. People are talking about Teignmouth and Dawlish, and they're not just talking about it here in South Devon, they're talking about it throughout the whole of the county, in fact across the country. And the reason they're talking about it is because of the team that you just saw in the video, because things are happening differently here than in a lot of other areas in the country. And that's just one of the triggers that we've got that says we have to think differently, and we have to think about, should we change our plans for your area? So we've got reasons for change is the first bit to cover here. And the first reason is because the way we can meet the needs of the population of Teignmouth and Dawlish have changed. If we can just go on to the next slide, please, that'd be hugely helpful. Thank you. If you haven't seen it, I think it is well worth looking at some of those independent pieces of work that Plymouth University have done and the Clinical Senate have done, looking at what's happening in Teignmouth and Dawlish, because some of the conclusions they've come to are remarkable and really good news for this population. Because of the way that primary care, social care, therapists, community nurses and the hospital are working much more closely together, they have seen much better improved outcomes for the population. So just as an example, admissions into the emergency hospital, into Torbay Hospital, are 6% lower for people in Teignmouth and Dawlish than they were before this new model. And also, when they do go into hospital, they're staying for less time. The opportunity to get home earlier is there much more in this area than other areas of the county. Fewer beds in the hospital are used for Teignmouth and Dawlish patients as a result. Also, the team that are available within Teignmouth and Dawlish, there are similar teams available throughout the county, but they are much more utilised in the Teignmouth and Dawlish area, which means that there is a confidence in that team for the GPs or for the hospital doctors or for the carers to refer into and to contact them when the help is needed. One of the key things that Dr. Matt Fox picked up in the video was that actually we need to think differently about where you go and where you receive your treatment. And one of the reasons is that we understand more and more now is that staying in hospital for longer than you need to is not good for you. There is a deterioration both physically but also mentally. And actually, if you're in hospital for shorter stays, your chance of getting back to being independent and well at home are much greater than if you spend a long time in hospital. We know that people who have received care from the intermediate care team, they feel much more in control of their own health. We also know that people in the Teignmouth and Dawlish area who have that support at home are much less likely to end up needing to move from their home into residential or into nursing home. So it means that people get back to their own homes as quickly as possible when they become unwell, but also have a better chance of staying in their homes and living independent lives. The second reason for change is to do with primary care, general practice. And you heard from two GPs within the presentation, within the video. And one of the issues is that the practice, and you can see in the slide here, Channel View Surgery, many of you may be patients registered at that surgery. And Dr. Kali Karakusevic, who's one of the partners of that surgery, is also on our panel here today. But she works for an environment that is cramped, that has a building that is not fit for purpose to be able to deliver the care that is needed. There's no disabled access for some of the floors, and so access is definitely an issue. And also, one of the things that helps general practice stay robust and to thrive and to be future-proofed is to be able to teach and train medical students, student nurses, trainee GPs, and then get those people come to Dawlish, come to the Teignmouth and want to stay. And it is very difficult to be able to do that in an environment where there isn't the space or the capability to provide that training. So the opportunity is to build the Health and Wellbeing Centre, as you saw, and to build within it purpose-built GP facilities that can co-locate with all of those other resources, the social care and the physiotherapy and the community services and the voluntary sector in the town centre, with easy access, with good public transport, and with the ability to engage and to train and to enthuse the next generation of health professionals. The third reason for change is because we have to make the most of our community NHS buildings, and we have to make sure that we provide value for money. Teignmouth Community Hospital has served its population really well. It has been around for many years, and it has been available to give care and to be the base from which care is provided for a long time. But it is old, and old buildings cost a lot to keep running. And to get Teignmouth Hospital back up to the sort of state needed to continue to deliver care would need at least £1.5 million to bring up to date. There are issues around disabled access, around privacy, and around some major engineering works which would need to take place. Also, it would cost a lot of money just to keep it running, to continue the services being delivered from it. One of the services that is present there is the day case procedures room, and in a moment I'll show you a photo of that room, but it is not the sort of place where we can continue in the long term to provide the procedures that are being carried out in it at the moment. And when you see the photo, it'll become clear why, that it is small, it is cramped, it doesn't have the sort of facilities that a modern day case surgery room should have. Dawlish Community Hospital, on the other hand, it's modern, it has spare capacity, it has that disabled access. The Health and Wellbeing Centre would also be modern and have all of those benefits that we've described. The fourth reason for change is that both nationally in the NHS and here in Devon, we are trying everything we can to bring those services that you depend upon together. So the social care services, the community nursing services, the GPs, the voluntary sector, who all do a sterling job to try and support people. If we can bring them together under one roof, as was described in the video, there is huge benefit for you getting much more of a seamless joined up care that you need. So both the NHS long-term plan and the GP forward view, which were produced by the national NHS, put a lot of emphasis on bringing these services together and coordinating them. And here in Devon, we've developed something called the integrated care model, which describes exactly that. And we'd like to see it not only in Dawlish and Teignmouth, but throughout the county, but taking a lot of learning from what we see happening and the opportunity available to us at the moment in Teignmouth. So we've got to this point because we've had the benefit of many years of talking to you about your services and about the opportunities for change. So way back in 2013, we came and we talked to you about what was important for you about your services, and then we had the formal consultation in Teignmouth and Dawlish, and we came up with some of the proposals which has led to that community team that you benefit from. We felt it was so successful in 2016, we extended it wider throughout South Devon and Torbay to try and replicate that model of care. And then 2 years ago, we came back to you and we talked to you about what we had learned and what we could do differently, and whether that changed our plans based on those 3-4 years of experience of caring for people in your community. So based on what we heard, based on those reasons for change and our experience, we created a vision of what things should look like for you. And it's for us to provide excellent integrated services. So that can be broken down into 4 things. First of all, we've been successful in the way that we brought our services together, but we can go further. We know that primary care is hugely important, that general practice is hugely important in Teignmouth, and we want to make sure that that is not just sustainable, but that is fit for the future for many years to come. We want people to stay well for as long as possible, but also when they need help to make sure that we've got the support available for them. And we want people to be able to stay in their own homes for as long as possible. So, to deliver this vision, we're going to develop a new health and wellbeing centre in the heart of Teignmouth, and you can see an artist's impression of that here. So that would bring together the GP, the Channel View Medical Group, the health and wellbeing team and volunteering in health into that single accessible building. We can get better integration of those services working together, and we would have more space available to cover things like some of that training, but also for other services to come in and be part of that team. We want it to be a great place to work. We want it to be modern and bright and sustainable so that we can attract new staff and the best GPs we can for the area. It's going to be part of the regeneration of the whole city. It's going to be on a level location. It's going to have good public transport links, and it's going to have it's going to be accessible for all floors, regardless of disability. So it's a real opportunity. And if we do this, then it gives us the chance to pause and think, what should we do about the services that are currently provided in Teignmouth Community Hospital? And that's the basis for our proposal. So this consultation has a single proposal and it has 4 elements, and I'll go through those 4 one by one over the next slides. But if this proposal were approved, then Teignmouth Hospital, Community Hospital, would no longer be needed because those NHS services would be provided elsewhere within the Teignmouth Dawlish area. It would mean that we would likely sell, Torbay and South Devon NHS Foundation Trust would likely sell the building, because we need to make sure that whatever funds we have available can be invested into the care that people need by their local NHS. So the first element of our proposal is to move all the high-use community clinics that are currently in Teignmouth Community Hospital to the Health and Wellbeing Centre in Teignmouth. And those clinics are audiology, physiotherapy and podiatry. And because ear, nose and throat, although it's not a high-use clinic, it works so closely with audiology, it makes sense for that to move to the Health and Wellbeing Centre as well. So most people who use these clinics are from the Dawlish and Teignmouth area, and actually they make up the bulk of the clinic work that happens within Teignmouth Community Hospital. So we would be keeping them within the Teignmouth area. The second element of our consultation would be for those specialist outpatient clinics, and you can see a list of them here on the slide, to move to Dawlish Community Hospital, which is 4 miles away. Now they make up only about 1/4 of the total appointments in the hospital, and interestingly, the majority of people who benefit from these clinics are from outside the Dawlish and Teignmouth area. It provides clinics for people throughout South Devon and Torbay. Now, Dawlish Community Hospital has got spare space and it can accommodate these clinics, which means that we can take them from Teignmouth into Dawlish without having to change the days or the times that they are held. The third element of our consultation is to move day case procedures that are currently happening in Teignmouth Hospital. And as you can see, that's oral surgery, pain management and plastic surgery. And we would move them from the current day case procedure room, which you can see here in the photo, which I referred to earlier, to somewhere that we will invest in and develop and spend £360,000 on in Dawlish Community Hospital to make sure that it meets the modern standards and has the space for it to continue providing day case procedures for many years to come. People for these surgeries come from all over South Devon and Torbay, and so we wouldn't just be moving things that are predominantly used by the people of Teignmouth and Dawlish, although the people of Teignmouth and Dawlish would continue to benefit from them being within their area. The last element of our consultation is that we would continue with the successful model of community-based care, the people who will work hard to get you home from hospital quickly, keep you in home, and make sure that your period of recovery, wherever possible, is in your own home environment, in your own bed, and is most likely to succeed. And in doing so, we would reverse the decision that we made back in 2013 to establish 12 rehabilitation beds in Teignmouth Community Hospital. These beds weren't designed to be medical beds in the same way that they might be considered in some of the other community hospitals and in the acute hospital at Torbay. They would be intended for physiotherapists and occupational therapists and healthcare assistants to provide that intensive rehabilitation. But we found that people in Teignmouth and Dawlish are gaining the rehabilitation and the therapy they need in their own homes without needing that dedicated space. In fact, people are more likely to regain their independence if it happens in their own homes as opposed to in a hospital bed. And also, the team that we have available to us, if we keep them working in the community rather than pulling them back into working in a hospital, we can look after 4 times as many people in their own homes as we would do should we have to look after them in hospital. We asked the Clinical Senate to look at this model of care, and they reviewed what had been successful so far within Teignmouth and Dawlish, and they agreed that actually the care being provided was sufficient to meet the needs of the people of Teignmouth and Dawlish, and that those 12 beds would not be needed. So just to recap, we're coming to you to hear what you have to say about this possibility. The possibility of moving those community clinics from Teignmouth Community Hospital to the Health and Wellbeing Centre in Teignmouth. Of moving those specialist clinics from Teignmouth Community Hospital, still within the Dawlish-Teignmouth area, to Dawlish Community Hospital, and doing the same with the day case procedures into Dawlish Community Hospital, into a better equipped day case centre. And for us to continue with the care that our teams provide in your own homes, but reversing the decision to establish those 12 rehabilitation beds in Teignmouth Community Hospital. Now, as you'd expect, when COVID-19 became an issue back in March and continues to be so, we reviewed our plans and our proposal to make sure that it was still the right thing to do. And we feel that it is, because COVID-19 doesn't change the opportunities that we have in Teignmouth and Dawlish, and it doesn't change what we should be doing with the community hospital. So for looking after people with COVID-19, when they become acutely unwell, we have the Nightingale Hospital in Exeter, and we have the facilities within our acute hospitals to look after them, and some of the other community hospitals. What they need is they need oxygen, and they need oxygen available, because that's the reason people come into hospital, because of COVID-19. Teignmouth Community Hospital doesn't have doesn't have oxygen or the ability to provide oxygen for those patients. Some may require rehabilitation after they've struggled with COVID-19, and that may be provided within a community hospital setting, but it has to be somewhere where the infection control measures to make sure that people are protected, both the carers and the relatives and the patients, from any further infection or cross-infection can happen. And Teignmouth Community Hospital is not set up in a way where that can be provided safely. Also, what we are planning in the Health and Wellbeing Centre in Teignmouth and the current Dawlish Community Hospital do have the ability to keep people safe and to keep the right infection control measures in place. So lastly, the last slide I have is just to say, get involved. You're here, you're part of this meeting, which is great to hear. But there are other opportunities. You may well have had the consultation document through your letterbox, and if so, read it and think about it and discuss it with your family, with your friends, with some groups that you may well be part of, and contact us with any comments or questions that you have, either with the online survey or in the consultation document, or by telephone or by email or by joining these meetings. And if you want us to attend any community meetings you have, then please do get in touch with us, bearing in mind that we are trying to keep things as safe as possible for people and reduce the number of gatherings in a physical space wherever possible. So thank you, and I look forward to the next few moments that we have to discuss some of these proposals.
Well, thank you very much, Paul. Yep, so thank you very much. That was Dr. Johnson, who's the clinical chair of the clinical commissioning group. Now, what we're going to do now is actually move on to the question and answer session. And what we're really trying to do is to address every topic and question which is relevant to the entire consultation. So a number of questions have already come in, which I'll come to in a second. But where questions repeat a previous one, or more than one is received on the same topic, one answer might do. So we'll try and sort of blend some of those questions together. If it's not possible to address a topic during the meeting, and we've had a few that have come in, particularly about statistics and things which we didn't actually have to hand, then we'll let you know, and the CCG will pass the response on to the frequently asked questions section on the website after the meeting. So we really want to tease some of these particular questions out, and what we'll do is we'll put the address up right at the end. I think it was there at the beginning, but we'll keep sort of posting that as we go. And the next thing I'd like to do is give our panel an opportunity to introduce themselves, what they do, who they are. So right, panel, come on board.
Okay. Hi, my name's Jo Turl. I'm the Director of Commissioning for all out-of-hospital services for Devon CCG.
Hello. My name's Adele Jones. I'm the Director of Transformation and Partnerships, and I'm here on behalf of Torbay Integrated Care Organisation.
And I'm Paul Johnson. I am a GP who has worked for a number of years in the South Devon area, and as Kevin already mentioned, the clinical chair of the CCG, the Clinical Commissioning Group.
Hello and good afternoon. My name is Carly Karakasevich. I'm a GP partner at Channelview Medical Group, and this week I will have reached the milestone of being a GP in Teignmouth for 27 years.
Excellent. That is terrific, everybody, and welcome. That would be excellent. Right, I've already had some questions come in, as you won't be surprised. And the first question I've got is from somebody I've known for a number of years. This is Joan Atkins, who is a town councillor and who's been a resident for 35 years locally. And let's see, Joan sent in about 2 or 3 questions. What I'd like to do possibly is just break those down a little bit, if that helps. Now, let me see. John wanted to first of all sort of raise some comments that were made in the Teignmouth Post last week. And right, so firstly, Anne-Marie Morris, who's the local MP, has expressed grave concerns about Dawlish Hospital being able to accommodate all the clinics that are intended to be located there, and suggested that the hospital should not be closed until that it is proven to be possible. Adele, do you fancy this one?
Thank you so much. Yeah, and that's a really important question, because it's important that we understand whether we can locate the services in our Dawlish Hospital. So there are 23 specialist clinics that will move from Teignmouth to Dawlish, and we've done a huge amount of work to make sure that there is space in Dawlish Hospital so that all those clinics can move from Teignmouth to Dawlish. And these are clinics such as dermatology and cardiology, so they're specialist clinics, so they don't run often, but they can all be accommodated within the Dawlish Hospital on the same day and the same time that they run at Teignmouth, so there will be no disruption. So it's just the move to 4 miles up the road from Teignmouth to Dawlish. So we're very confident that that can all be located in Dawlish, because Dawlish is underutilised at the moment. Hope that helps.
Okay, and if any other panel member wants to jump in on any of these questions, just wave at me, and I'm sure that we'll find some space. Right, this is a follow-up from Joan and Anne-Marie. So Anne-Marie also says that this consultation cannot agree that the 12 rehab beds are removed. This must be another consultation post-COVID, the same for the hospital closure. And Paul.
Thank you, Kevin. So I think, first of all, with regards to the decision around the hospital closure, we want to come and consult with you about services and about the care you get, not about buildings, because actually what's important is making sure that we make the most of every penny that we have in making sure you are looked after and kept well for as long as possible. And when you are unwell, you get the care that you need. With regards to the 12 rehabilitation beds, what we have learned and what's been shown to be true by the independent assessments that we've got is that the team that we have available to provide care in the community, whether that be in a hospital bed or in your own home, they're managing to do it really successfully with what they have available to them at the moment, which is being able to go out and spend time in people's homes. Now, what we don't want to do when we know that there is likely to be more people in the winter and possibly with COVID who need that time where they need some support in their own homes after being unwell, what we don't want to do is to pull those teams back into the hospital where, yes, we can look after people, but it's a quarter of the number of people that we could otherwise look after if they were in their own homes. And so we are consulting with you about whether that should be the right thing to do, but we're incorporating it into this because it helps paint a whole picture of what we can do for you in the whole pathway of the care that you need when you are at home or when you need extra support. So it goes very neatly with the sort of opportunity that we have available with us around the new Health and Wellbeing Centre and around the Dawlish Community Hospital, but mostly importantly about how our teams are working so well together at the moment to keep people in their own homes.
Okay, thank you there, Paul. Right, this is another one which I guess comes from the Teignmouth Post last week. And Anne-Marie Morris also says your information is out of date and pre-COVID. There is insufficient clarity about separation of non-infectious and non-elective conditions and no plans as to how they might run them together, etc., etc. Do you have any response to that, please? Again, I think this one's for you, Paul, is it?
So I'll start off, but I think Adele will be able to talk about some of those plans that the Trust have put in place to make sure that people with COVID symptoms and those without COVID symptoms are kept safe from an infection control measure. So I'll go back to what I said before. I think the key thing is that we have to have environments where people can be kept safe. So whether that be a community hospital, whether that be the Nightingale ward, whether that be one of our 4 larger hospitals in the county, and they have to have the ability to have the right infection control so our staff are kept safe and so our patients are kept safe whether they have COVID or whether they don't have COVID, and so that any relatives, those sort of people are also kept safe. And that's very dependent upon the environment that you work in. And Teignmouth Community Hospital, the ward that has available there, it just can't provide that level of infection control. So even if we had the beds there, they're not things that we could consider would be safe in providing care for people in this COVID environment where infection control is so crucial. But Adele, you might want to talk about things particularly for the Trust on this.
Yes, yeah. Thanks, Paul. I'd really just want to reiterate what you've just said. So the teams at the Trust work really hard and have worked really hard all throughout COVID to make sure that there is real separation for people who may have COVID symptoms and those that don't and are coming in for their kind of routine or elective care, so their routine care. So people use separate entrances. There's really kind of clear infection control arrangements. Now Dawlish Hospital allows us to do that because of the modern facility. Unfortunately, and we've looked again at Teignmouth Hospital, the infection prevention control measures for Teignmouth are we just cannot put any more services into Teignmouth due to the more stringent need for infection prevention control. So we're confident that all the other facilities that we've got, all the other hospitals that we've got, that we can manage that separation of COVID and non-COVID to deliver the services that we have agreed to run from those buildings.
Okay, right, thank you, Adele. Yes, Scarlett.
I was just possibly slightly off the topic of the exact question, but I thought it might be helpful to just add a little bit about how primary care, how GP service surgeries are working differently at this time as well. We're all aware as soon as you set foot outside our own homes of the changes that have come to our day-to-day lives because of COVID, whether you're going to a supermarket or just walking down the road. The GP surgeries in Teignmouth and Dawlish have had to adapt and change and make their surgeries as safe as they possibly can. As Paul went through in the presentation earlier, we are constrained by old buildings and we have limited ability, but nonetheless we've made every change we possibly can. And I think the change that people will notice most obviously are the different ways that we've altered our appointment systems and the way people access our services, a lot more by telephone, video consultations and so on. And when we need to see somebody who may have COVID symptoms, each surgery has worked out a way of doing that as safely as we possibly can to ensure separation. So I thought it was helpful just to mention that, although it's slightly off the subject. Thank you.
No, that's fine, Carly. And in fact, the next one I think looks like it might be one of yours. Right, this is anonymous, but how many people do you expect to use this facility on a daily basis?
Right, that's actually quite difficult to answer. And I think when you mentioned earlier, coming up with statistics, that is something that we can't immediately answer now, because how we're working right now is very different from how we were working this time last year. And I can't really hazard a guess as how we will be working this time next year, although I'm hoping it's very much closer to how we used to work. There's a far smaller footfall into GP premises at the moment for all the reasons I've just mentioned about COVID. There's a lot in the national press and coming from the Minister for Health telling us that we should be doing vast majority of our work remotely. And without being argumentative, I would say that I agree with that to a point, but there will always be reasons to need to come to GP surgeries. Now, that is far greater for procedures, and by that I mean things like needing an echocardiogram, the tracing of the heart, blood tests, smear tests, those sorts of things, dressings and whatnot. So those things, almost all, will need to remain face to face. There is a proportion of GP work that can be done remotely. And in my own practice, we've adopted a system like that for about 7 years, so that we talk to all patients first before booking an appointment. And that means sometimes we can organise a blood test and someone only needs to come in once to our building rather than several different journeys. We need to design a building now that is flexible for the future. It's very hard right now to predict what that future looks like. But we absolutely need to have premises where we can provide the GP core services. And I think the opportunity, I very strongly feel that the opportunity to share a building with the community teams, the health and care and the voluntary sector means that we can be flexible and provide health and social care to the residents of Teignmouth and Dawlish in a much more flexible and effective way forward.
Thank you, Carly. Now, this next one is anonymous, and it's presented in a quite light-hearted way, so thanks for that. But there is a really serious point to it. The quote is, "It seems that the new co-located surgeries proposed will be in an area prone to flooding, according to climate change forecasts. In that case, should it be known as the Wellbeing Centre?" But really serious points, dressed up in a light-hearted way. So, Adele, this one for you.
Thank you, Kevin. Obviously the majority of the town centre is in a flood risk area. So all buildings that are built in Teignmouth would be subject to the same risks. We've designed that in mind. So the developers have been working with us to make sure that we are able to design services so that if there is a risk of flooding, those services would be maintained and that we mitigate any risk around flooding. So just assuring you that actually we've taken all of that into consideration, given that we know the risks of floods in Teignmouth.
Okay, thank you very much. My neighbour with his drill might be coming back. I've just heard him there. So apologies for that one. We'll carry on through. Right, this is from Larry, TQ14. There's a little bit of follow-up from before, I think. Shouldn't this consultation process be postponed until the ramifications of COVID pandemic become clearer? Paul, I think.
Okay, so I mean, I'll start off, and then Adele, the opportunity that we have that is time limited, I think would be good to also cover. I guess COVID is here. It's going to be with us for quite some time. And one of the things that we did when we first faced this crisis back in March was stop everything else. And we stopped all of our planned surgery, we stopped all of our outpatients, general practice stopped virtually all of its face-to-face, but actually, as you hear, it never stopped totally and is coming back in a balanced way. But we made sure that we were prepared for COVID. What that's left us with is actually a big shortfall of some of the things that we were urgent then and are still urgent now. And that goes as much for planning for the future. If we put our planning for the future on hold for this year, for next year, potentially the year after, until we are in a COVID-free environment, whatever that might mean, then we will be behind the opportunity that we have available to us. And so we shouldn't stop, but we should do things safely. And that's why we're having these virtual meetings rather than face-to-face. We still think that we can have these discussions with you as, you know, in a safe way and still have the useful conversation. But we can still go on making plans so that when COVID is not something that we are having to deal with day in, day out, we are well on the way to making progress in getting some really good quality, future-proofed facilities and level of care available for our populations. So we shouldn't pause. We paused for a number of months and we're now having to play catch up. So we shouldn't continue to pause. We should stay focused on both what COVID challenges us with, but what we need to do to keep the future right for people. Adele.
Yeah, thank you, Paul. Thank you, Paul. Can you hear me?
Yes.
Yeah, sorry, I'm not. The little red box isn't around me, so apologies. So it is now. So yeah, I couldn't agree more. I think for me, COVID, all the more reason that we put more effort into planning our services and doing this really well. So we have, within the plans, we've made provision for the specialist services to go to Dawlish Hospital. We're making provision for a large number of community clinics, so 73% of the community of the activity in Teignmouth to go to the Health and Wellbeing Centre. And we're really clear that those services will be in fit for purpose buildings that will build on the fantastic services that have currently been delivered through Teignmouth Hospital. And the services that we've got in Teignmouth are they're national best practice. They're really, really positive. And COVID, we shouldn't let COVID kind of throw us off our course, I would say. COVID will leave ramifications in terms of people waiting longer for procedures because we've stopped services. And actually, I agree with Paul. We need to just to get back to providing routine care as safe as we possibly can, and that means that we have fit for purpose buildings like Dawlish, like the new Health and Wellbeing Centre, that allows us to catch up, keep people well by providing them with that routine care, and that's the basis on which the health and wellbeing of Teignmouth has thrived over the last few years from this model. So we ought not to stop just because COVID is with us.
Okay, thank you. That's great, Adele. Oh, this is an interesting one. Anonymous, who would be responsible for running the Health and Wellbeing Centre? Adele, do you want to pick that one up?
Yes, thank you. So as the trust would hold the head lease. But as with the development of the building, so if we think about how as partners we've worked with primary care, all the other services, the range of services that will be in the Health and Wellbeing Centre, whilst we'll have the head lease and we will run the building, this will absolutely be about partnership, because everything that we do in the integrated care organisation is absolutely about partnership. So we will run the head lease, therefore you can be assured that we will meet all the relevant infection control obligations and health and safety obligations, and that there's a big organisation holding the responsibility for the building. But critical to us is the services within that building meet the needs of our local people, and our GPs and our voluntary sector are key in terms of ensuring that we understand what those needs of the local people are, and that our services reflect those. So whilst we'll be holding the head lease, we'll be delivering services in partnership with our colleagues.
Thank you. Carly, did you want to comment?
Yeah, thank you very much. I think it's important to say that, as Adele explained, the Trust will be holding the head lease, but primary care and the voluntary sector have been, and the health and social care team, have all of us have been involved with the planning and design of this building. And that's particularly important, and it's been very beneficial to have that as an iterative process. So it has moved and changed, and in the consultation document there are floor plans. There's still scope for those rooms to change position, not the shape of the building, but the actual use of different rooms. The reason to do that is to ensure that we work as flexibly as we can, and help use the building to break down the barriers between teams, so that we really do work as one body for the benefit of the patients, rather than as we do at the moment in lots of separate teams, where we have to slow down care because we pass things from one to another. So one of the advantages of this building is having us all in one place, and it becoming immaterial who you actually work for, what your job title is. It's actually what can you do to aid the position of the well-being of that particular individual you're looking after.
Thank you very much. Right, the next one is a comment and a question, I guess. Right, and I'll quote this one. There's an air of desperation in the claims being made by the clinicians, who seem hell-bent on closing down a much-valued hospital, which has so much potential, which is bound to be necessary after the pandemic. I think I'll just open up to everybody and clinicians. And Paul, do you want to come in first, and then we'll let anybody speak on this one?
So I'll start off. So first of all, if I were to be brutally honest, I would say I don't care about buildings. I care about the care that we can provide and the services that we can use to provide that care. I also care about making sure that the environment in which our staff work is one that promotes that collaborative approach, that gives them a sense of well-being, and that means that they can work efficiently and effectively for the people that they're looking after. So those are my priorities. And when I look at the proposed Health and Wellbeing Centre, and when I look at Dawlish Hospital, I see two environments where that can happen. And when I look at the community team and what they've been doing over the last few years in Dawlish and Teignmouth, I see a service that is delivering really good quality care to the community. Now, those are the things that I want to see happen. And when I look at environments that are really more difficult and challenging to work within, then I struggle to say that that should continue because of its history or because of what it means to people. And I know it's an important place, and I know it has done so much for the community. But when keeping it going has a detrimental effect on either the staff that work in it or the opportunity that we have to care for people, then as a clinician and as a leader of the commissioning group, my priority has to be with the services that we provide and the staff. And that's why I'm here talking about this, because I think this is an opportunity for that service to be even better than it is now. And that's what I'm focusing on, and that's what I would want to see delivered.
Yeah, that's well. Anybody else like to come in on that one? Yes, Carly, please.
I think, obviously, as I said, as I introduced myself, I'm reaching my 27-year anniversary this week. I think Teignmouth Hospital has served the community very, very well over a number of years, long before I came here as a GP. And I've looked after many patients there myself. But I do feel that times have changed, and two aspects. One is that people do prefer to stay in their own home if they possibly can for their care. And the health and care team, since its inception, have such a great reach. They have been able, as the Paul covered the figures in the presentation, there are so many more people who've been able to be looked after by the health and care team since the change from the traditional community hospital, which I used to work in, and I now work with the health and care team. And I have to say, I'm enormously impressed by their ability to look after people and the number of people that they can look after, with us as GPs supporting them in the community.
Okay, thank you. Anybody else want to respond to that one? Yes, please. Joe.
So thank you, Kevin. So I suppose I will, I'm not a clinician, so I'll talk about this. I'll come from a slightly different perspective, won't I? And my job as Director of Commissioning is to, it's my responsibility to make sure we look after the needs of all of our population, with a particular focus on, yes, the now, but also the future as well. And I think what we've seen in the presentations today is that we know we can meet the needs of patients. As Carly's just said, by and large, people want to be at home for as long as they can, and be cared for within their own home. We know we can meet those needs, and actually we can meet the needs of more individuals if we change the way that we provide services into the future. And yes, I understand that Teignmouth Hospital is a much loved building, but we know, given what everyone's just said, we know it isn't fit for purpose, and it's not going to be fit for purpose. And the engagement that we've done with the public, and I was involved in that engagement back in, it was summer of 2 years ago now, actually. The feedback was actually that wasn't an appropriate site, and actually people wanted a site that was on the flat, was central location, easier to get to, public transport. So that's what people are telling us that they want. And there's also a comment there about the necessity of having the building after the pandemic. My team are currently working on, so there's been a bit of guidance that's come out from the central government around aftercare needs of individuals with COVID, and we're working through that guidance at the moment to work out how we need to support those individuals. And that isn't hospital-based care. It's really clear that is care at home to look after those individuals. So I feel confident that we are planning for that. We'll be able to manage that, but this building won't answer that for those individuals. That's all I would add from my perspective.
Okay, thank you very much for that. That's terrific. You mentioned workforce there. I think we've got a couple of workforce questions that are coming up. Right, this is anonymous, and it is keeping people in their own homes for as long as possible is fine. But as people are living longer, many elderly people will ultimately require 24/7 nursing care. How are they going to meet the requirement for thousands more nurses when the UK is already 50,000 nurses short, and Brexit isn't helping, is it? Right, Adele.
Thank you. That's quite a question, isn't it? It is a really important question, and it's one that we spend a lot of time looking at the Trust. We have so let's kind of think about this in terms of the model of care that we're proposing here. So the model of care means that we can look after more people in their own homes with nursing support than we would be able to in beds. So we're already making more efficient use of nurses by using this way of caring for people. And it's important that where possible, we do support people in their own home, A, because it means that people maintain their own independence for as long as possible, but B, it does reduce the burden on long-term care and the provision of long-term care for all the reasons that the person proposing the question has raised. So then, in terms of kind of recruitment and into long-term care, we're doing a huge amount of work with our education institutions. So there are more places around apprenticeships, kind of apprenticeship models for nursing to really widen the entry into nursing. What's really good is, I think, with the COVID pandemic, you'll see nursing numbers recruiting into education have increased, which is absolutely brilliant. We're doing a huge amount of work with Devon County Council on the Proud to Care campaign. And it's a fantastic campaign that really makes sure that people, the reputation of care home work or domiciliary care work is valued for the very, very special contribution that those people make to people's lives. So, and there's a huge amount of work that's going on. That's alongside international recruitment that we've been doing for many years now, and which has been very successful for us. So there is a range of activity that's going on, but I would say that the model that we're proposing for Teignmouth is the sort of model that means that we can make the most of the scarce, some of that kind of scarce nursing resource, and that we should try and nationally people are looking at us as trailblazing that, so that they can resolve some of their own workforce shortages too.
Thanks for that. And Carly, did you have your hand up, or shall I move on to the next question? Yeah, okay, because the next one is going to be another workforce one, and looking at our ageing society, and this is anonymous. We are going to need a massive number of trained nursing staff and many extra GPs to keep people in their own homes. Local nursing homes are old Edwardian Victorian houses, which aren't designed to cope with moving elderly people around safely and securely. And many of them are already unsuitable, according to the Care Quality Commission, that's the group that sort of inspects those homes. So come on, let's be honest, we're going to need more specialist facilities for ultimate care of the elderly. These proposals are defying logic. Oh, Joe, this one's for you, I think.
Yeah, thank you, Kevin. Yeah, it's a really good question, actually. I'm not going to, Adele's really eloquently actually talked about some of the work that we're doing around Proud to Care, so I'm not going to repeat some of that. I can so one of the teams that I work with in the clinical commissioning group looks after general practice, so working with the GPs and practices. And we've been really successful this year actually in recruiting some GPs into Devon, which has been fantastic as part of working with our local medical council and advertising nationally to get GPs interested in coming into Devon, and we've been quite successful with that this year. So I do feel confident that we're on a sort of progressing trajectory on that, really. So that's really good. In terms of the point though about nursing homes, so at the moment, capacity in terms of that long-term care, we've got enough of that at the moment, generally speaking, but what we know is absolutely we're going to be on a sort of increasing trajectory there in terms of the needs of the population as they get more elderly, more complex, and we do know that there is need for more specialist placements, long-term placements. So I'm specifically probably thinking about older people with dementia, that type of placement. So we're working really closely with our local authority colleagues at Devon County Council, and my team at the moment are working on what we're calling, we need to come up with a snappier title, but it's basically about our out of hospital community services, which includes care home placements, long-term placements. So we're working together with the council, who've got a market strategy, and working with existing providers within the locality, but also providers of care elsewhere, to look at how over the longer term we can make sure we've got enough of those specialist placements so that it's fit for our population moving forward.
Thank you, that's terrific. Just a bit of a gratuitous plug for the voluntary sector here, the volunteering and healths and the King's Cares and the community transports and the League of Friends and all those many organisations out there. Just thought I'd put that in. Thank you very much, that's great. Next one might be a straightforward question, and this is for anonymous. Will Barton surgery stay where it is? And that's Joe. Yeah,
thank you, Kevin. So yes, there's a very straightforward answer to that, right, but I'll expand it a little bit. So Barton surgery, for people who don't know, is Dawlish. So yes, that surgery will stay where it is. The plans won't affect Dawlish surgery for patients of that surgery. What I will say is, obviously this is affecting the practice in Teignmouth, but it doesn't also affect any of the branch sites as well. So practices, for example, in Chudley and Shildon, doesn't affect those either. The other thing I would just want to say is that the practices do work really closely together. So Dawlish and Teignmouth are part of what we call a primary care network, and Carly might want to come in, but the practices are working really closely together to plan care for patients in the whole locality. So actually services coming together across the locality, I think, is a really good benefit for patients, and those practices working together. So I'll hand over to Carly now.
Please.
You stole my thunder, I'm afraid. What I was itching to say, because I think I'm not sure it is entirely clear in the documentation or in the presentation that's been put together, that although the GP presence in this building is my own practice, the coming together of general practice, the community services, the health and social care team and voluntary sector, not all of whom will be in the building, but some of whom will be in the building and some who will have a drop-in facility, will have a benefit for all patients across the coastal area. And the coastal, I mean Teignmouth and Dawlish. And it does get a bit confusing with the geography because my practice area goes to Chudley and Bishop Stainton, so they come under the coastal area. So any patient who's registered in any of the practices in Teignmouth or Dawlish based ones will have the benefit of improvements in service that come about by sharing this building, whether or not you go to that building for your GP surgery services. And I think that's a really important point.
Right, thank you. Next one, and this, we're just talking about the voluntary sector, and this comes from Vincent Wilson, who's the manager of the Citizens Advice Team Bridge, and Healthwatch and Citizens Advice have worked very closely together. Right, so Vincent's question, hi Vincent, and the question is there scope for Citizens Advice to be involved? Health and wellbeing are tied up with financial stability, and many people with long-term illness and disabilities need advice and support around issues like benefits, debt, housing, etc. We can help and assist with the aim of helping people to keep people in their own homes, and this can reduce reliance on care services by improving mental health in particular. Adele and possibly Carly.
Oh, thank you, Vincent. That is a brilliant question, and yes, please. So I think, you know, fundamentally, and you've heard it in the presentation, but you've heard Carly describe this a lot, you know, involvement of the voluntary sector is critical, isn't it? It's critical to the delivery of our services, and people's well-being and health is absolutely predicated on, you know, feeling financially well and having good housing and eating well and all of those really, you know, are those things that make us human beings and keep us feeling safe and able to get on with our lives. So so we'd love to work with you. So you know, there is space for the voluntary sector, and you know, we're keen to work in partnership with the voluntary sector. So yes, please.
Excellent. Carly.
I echo everything Adele has just said about that. The other aspect, and it is an area that's in its infancy. As a group of practices in Teignmouth and Dawlish, we work, as Joe mentioned earlier, under an umbrella called the Primary Care Network. And that network has the ability to employ some posts. One of those is a post for someone called a social prescriber. And a social prescriber is working for us, but doing very similar to things to what Vincent's talking about. And I think it's really important to recognise that we shouldn't be trying to make everything medical. And that might sound a bit strange as someone coming who's been trained as a doctor and worked as a doctor for all these years. But there are an awful lot of people who would benefit from help and support to look after themselves. And that doesn't need me, and it doesn't need a nurse. It needs people like Vincent and a social prescriber. So I'm going to be really, really keen to make sure that you have space of whatever's available. So I'm happy to have conversations outside this meeting.
Right, there you go, Vincent, you've got a lead. So thank you very much. Next one, it's fairly straightforward. This is anonymous again. What is the planning permission status of the new proposed health centre? Possibly Adele?
Yeah, thank you. We've engaged with the Teignmouth Planning Department, and we've done a huge amount of work in pre-planning with the conservation officer. So we're really clear that we've got a really good design and it's consistent with what the planners would be looking for. So it's been really useful in kind of structuring our planning application. So the full planning application, subject to kind of us getting approval, would be submitted in late October, with us then starting works kind of sometime in the spring.
Right, thank you. And coincidentally, the next question is from Councillor Sylvia Russell. Hi, I've known Sylvia, 20, 30 years now. Hi, Sylvia. And the quote is, your planning application for new health hub is not yet ready for public scrutiny. and as it is a major development in the centre of Teignmouth, it would take some time to go through the planning process. Can the CCG confirm whether the services currently available at Teignmouth Hospital will not be moved gradually to Dawlish in this interim period? Back to Adele, I think.
Yes, so effectively, if the proposal's approved, there's two elements of the proposal, aren't there? So if the proposal's approved, at some point we will be making roads to move the specialist clinics. Now, bearing in mind they're small volumes, so they're 27% of the activity of Teignmouth, and they would be moved gradually to Dawlish. But before we did that, we'd have to do the works in Dawlish anyway. And they will take some time. So I would expect there will be time for public scrutiny of the planning process while we're doing works in Dawlish, because we know that those services do need a fit for purpose, proper infection prevention control environment through which to kind of to deliver those services. So then the remaining, obviously then planning permission will hopefully be approved, and then we'll start to build the Health and Wellbeing Centre, and at that point then we will be moving services from Teignmouth Hospital to the Health and Wellbeing Centre. So there's works to be done in Dawlish before any clinics or services are moved. So which should allow Sylvia and other colleagues to scrutinise the proposals.
Okay, thanks very much, everybody. Thanks, Sylvia, for that one. Right, anonymous question that's come in. How many people are on the webinar? When we cannot see attendees, it's useful to know when the meeting starts. I can't tell from sitting in the chair. So, Joe, do we have an answer on that one?
Yeah, sorry, Kevin, just coming off mute. Yeah, so we haven't. So people are dropping in and dropping out all the time. So we as presenters, we can't see who's how many we've got in total. But what we will be doing, so when we finish, we'll be able to see how many people have gone on. So what we'll do is when yourselves, Kevin, in Healthwatch put the report together at the end, we'll be able to have the figures of who's been on every single webinar. So we'll be able to add that up and give people a good idea of how many have joined in that way, but also how many have responded via the information and the questionnaires that we sent out in the post as well.
And a significant number of questionnaires went out, so and I think they're still coming in at fairly good numbers, I understand.
Yes, they are.
Okay, brilliant. Right, another interesting one. Anonymous, how much of a catchment area is there for the current Teignmouth Hospital clinics from the Star Cross side of Dawlish? Joe, yeah, about this?
Yeah, yes. Me again. I'm afraid though, again, I'm going to disappoint slightly because I haven't got an exact answer to that question. So we've done an assessment of the impact on everybody and where they come from, where they live. And I know, so what I can say on the webinar is I know that the maximum really that anyone is going to be affected by the change to Dawlish for just the specialist part that we've talked about is 4 miles. So that's pretty much the maximum. And we know that's actually for a minority of people. And we know for a lot of people it will actually be a shorter distance because a lot of people using those clinics are from outside the Teignmouth area, as Paul talked about in his presentation earlier on. But we have got all that information. So we were one of our team's going to post a link, if they haven't done already, onto the Q&A part so that people can link in there and see what the direct impact is for people in certain areas in the coastal locality as well.
Okay, thank you. Next one, anonymous. When a patient contacts the Health and Wellbeing Centre, will it be a single number and then directed to most appropriate health profession, or is there no direct access from patients? Carly, then possibly Adele?
That's absolutely fine. Sorry, my hesitation was I thought you were about to say it the other way around. So I do apologise. The GP bit of this will have phone access, hopefully better than we have now. My own practice, Channelview Medical Group, formed from the merger of Teignmouth Medical Group and Channelview Surgery on the 1st of April. And it's probably, I'm not sure how obvious it is from the front of house bit from patients' experience, but by a quirk of history, we have 2 different phone systems at the moment. So patients, it's useful in, we haven't changed any of the phone numbers, so patients contact our surgery in the way they always have. In the long run, we need to have one phone system so that our surgery larger surgery can work more efficiently, and we need to dovetail what we offer with the new Health and Wellbeing Centre. So absolutely, patients will be able to phone that building and access us, because that's how everybody accesses GP surgeries now. So can I pass to Adele, who I hope is going to agree with that?
I agree with that, yes.
Okay, thank you very much. Right, we're not far off the end, I think. This might be our last question. So if anybody's out there that wants to ask a question, let us know now. And this is anonymous. Right, how well known is it that all these proposed changes are being carried out at the behest of a hedge fund company seeking to maximise their assets, with a prime development site overlooking the beautiful Teign estuary? Oh, interesting. Adele, and yes, anybody, just come in on that one.
Okay, well, shall I make a start, and then other colleagues come in? So this is about us really making the best use of NHS resource. So I can't comment on private investors and then what money they would make. What I guess I can comment on is how as an NHS we make best value for the public purse in terms of delivering services. So effectively what we're proposing is to develop sustainable services through new modern buildings, using a private finance initiative, where the building, at the end of the life of that building, that building is maintained through its life cycle. And if you think about some of the estates, so some of the buildings that we own as a trust now, the older a building gets, it's like having an old house. The older a building gets, the more expensive it is to just bring it up to kind of the basic standards. And as we've said before, in order to maintain the delivery of specialist services and really effective kind of COVID-proof infection prevention control, we need really modern buildings. So the investment in new buildings is being done in the most cost-effective way that it can be done for us as an NHS. And so that's the first thing I'd say. And then at the end of that contract, so it's a 30-year contract, so the investors would maintain the building through its life cycle, and then that building would be owned by the NHS. So it's a reasonably efficient way to do it. In terms of any then potential redevelopment on the Teignmouth Hospital site, if we move our services out of Teignmouth Hospital, if the people of this area approve the proposals that the CCG are putting forward, then the Teignmouth Hospital building would not be needed, and then we would be looking to seek somebody to work with us around buying that asset. But that's kind of a next stage in this conversation. Primarily we want to focus on developing buildings in partnership with investors to ensure that our people have access to the best possible healthcare.
Okay, thank you very much for that one. Right, this is it. This is let's see. I think I'll open this up to everybody. I mean, one of the things I said right at the beginning is that we're not here to censor questions, just to really sort of throw them out. But let's ask this question. If people want to respond, please do, but don't feel under pressure. Right, if these health professionals are so keen on the voluntary sector, how many of them will be taking a pay cut or even seeking to become a member of volunteering in health? Anybody wants? Incidentally, I have been a member of volunteer with volunteering in health. Right, you're in, Joe.
Yeah, so I was just going to say, so in terms of volunteering, so one of the things, interestingly actually, so one of the things that the clinical commissioning group did when it first became the clinical commissioning group back in last April was we implemented a volunteering scheme in the CCG. So all members of the CCG are given the opportunity to do some volunteering and take some time out of work to do some volunteering. So everyone's encouraged to do that, including myself and Paul, who are on here. I've certainly taken up that opportunity, and I'd be if anyone wants to suggest any opportunities to do that, I certainly personally would be very glad to help support. I live locally, I live in Teignbridge area, so I'd be really happy to see what opportunities there are out there.
Thank you very much. Anybody else want to respond? That is our last question, I think, at the moment.
Can I just say something on that, Kevin? And I think there's what I think in the conversations, what we're not trying to do is saying it's all down to the volunteers and the voluntary sector. In the voluntary sector, there's a wealth of people who want to do something, who want to help their community and their neighbours and the people around them, but quite often have felt very detached from the statutory services. So one of the main reasons of bringing them into the same space and for them working much more closely is so that we can benefit from their enthusiasm, their energy, their skills, their experience, and they can actually feel much more closer and linked in with health and with social care. So it's an opportunity to get people who are already there, who already want to provide that volunteering service, to do it in a way that is much more closely aligned with the GPs and with the community nurses and with the social workers and so on. I think as far as what should our response be as clinicians, I want to just say something about my clinical colleagues, and Carly is one of them, that quite often, because of the amount of care that people need and the number of patients that they have to look after every day, which they want to do, which is the right thing to do in general practice, you will quite often find that they are staying way beyond when they should have gone home, and that on their days off, now that they have a computer which gives them access onto the system from home, will be logging in order to check on blood tests, check on letters that have come to hospitals, to plan the next day. And so they may not be specifically volunteering, but they are voluntarily giving up quite a lot of their time when they shouldn't be at work, working in order to meet the needs of the population. So I would back them 100% that they are volunteering, just not in the most obvious way that people would expect.
Thank you very much. I think we're almost there, folks. No, I'm just looking at my panel. No more questions. I think we'll pretty much close. Right, well, just my personal thanks. So that's pretty much the end of today's meeting. Yeah, let me thank everybody who's actually taken the time. So that's the panel, residents, elected members, particularly the folks behind the scenes who we never see. So that's the CCG staff, the Health Watch staff, the volunteers that have taken their time out to write those questions down and respond as much as we can do. So I hope you've actually found the session interesting and useful in coming to a view about that particular proposal. Doesn't stop here. So I'd really urge you to, keep sharing those views, and there's lots of ways of actually doing that. And I think we've got a slide coming up a little bit later. It might be coming up now. So first of all, I'd like to know actually how you actually found the session went, and it's unusual circumstances. I think at any other time we had plans of big sort of public meetings. We had ideas about putting a sort of consultation bus in the triangle and just sort of grabbing everybody, but that, because of this whole COVID thing, that didn't work. So there is a quick survey that we've actually got, and there's a link on your screen, SurveyMonkey, just to tell us how you think it went, how we could improve it, how we can what worked, what actually didn't work. So fill that one in. Generally filling in the survey, if you can do that online, and you'll find a paper copy in the consultation document, which, as we said, has gone out to I think 17,000 homes. If you want us to sort of contact your community meeting to present the proposal and gather feedback, please let us know. There we go, in front of you. So fill in the survey online, attend community feedback meetings, any online meetings. There's going to be another 2 of these after today. So they're going to be the same kind of format, but please come back. Any questions that you actually have, anything that you want to sort of raise. And I said we've been fairly open with these questions. And that's pretty much it. You can contact the CCG via us at Health Watch by telephone and email, and my volunteers and staff will actually help people sort of fill in any forms and fill in the questionnaires, or just phone us up and tell us things. We really want to sort of gather everybody's views over these proposals. So once again, thank you everybody. I've enjoyed it and I hope you found it useful. And again, thanks panel, thanks residents, thanks elected members. Have a wonderful afternoon, and I'll see everybody soon. Thank you very much for your time. Bye-bye.
Thank you.
Yeah.
Thank you.
Bye.